Thank you very much, Christine. So the first thing, and thanks to all of you for joining, this is an important webinar. It is part of the mandates that take place within the bills that Governor Ducey passed. So I wanted to also give credit to the other organizations that we work with that are sponsoring this Click for Control campaign. It is, of course, Health Current. We are the HIE for the state of Arizona. The Arizona Health Care Cost Containment System, which of course is ACCESS, the Arizona Department of Health Services, ADHS, and the Arizona Board of Pharmacy. We all bonded together when we realized that folks were going to need some help being able to get up and live and meet the mandate. So the first year of the program, I went through and helped everyone figure out how to find the software if they didn't have it, what to ask their vendors, all of that kind of information. So if I have anybody on the line that does not yet have EPCS software and would like some assistance with it, please feel free to let me know, and I'll be happy to help you with it. Also, what we're going to be covering today is basically physician assistant responsibilities. However, lots of other responsibilities are covered in this, as well as prescriber and pharmacy responsibilities. We also will talk a little bit about controlled substances, which is the CSPMP, Controlled Substance Prescription Monitoring Program, which is also mandated, and how you go about accessing it. We also have information in this presentation about where we stand in Arizona versus the national landscape, and it's exciting to me, but I wish we would get moving a little bit faster, and I'll show you what I mean when we get to that part. We also will be covering an opportunity for free online CME, gaining your CMEs that you need for your license renewal. It's interesting that it's online, and it works very, very well because you can stop it in the middle of it and come back to it, so it does really save you time. And it's free. That's another good part of it. And then I'll talk a little bit about some Click for Control resources that we do have available. I'll talk about that at the end. So if you need to get to it, you'll know how to do it. So for physician assistant responsibilities, one thing I want to tell you about each one of the slides, you'll notice down on the bottom it says HB 2075, which is House Bill 2075. This is where the mandate was better addressed and described rather than the original House Bill 2021, which was 1001, I'm sorry, that explained that was the original Opioid Epidemic Act, and some of the things for physician assistants were incorrect in that bill. So Governor Ducey passed House Bill 2075 to correct those things. And you will see where after 2075, it says 32-2504. When you go to House Bill 2075, you can scroll down until you come to 32-2004, and you will find the information that I'm talking about on each one of these screens, which will help you a little bit better look up and find out how it's actually stated in the House bill. And I've tried to, of course, put it in a little bit better layman's language to help everyone be able to understand it. So the basic things for physician assistants certified for are 30-day prescription privileges for schedules 2, 3, 4, and 5 of controlled substance. And it's very specific in the mandate. It always says Schedule 2 controlled substances that are opioids or benzodiazepine. So I want to make that clear to you there. A lot of folks will call me and ask me if a certain drug is covered, is it considered a Schedule 2 controlled substance? And because I am not a pharmacist or a medication expert, I'm not able to answer, nor am I allowed to answer those questions. Those questions need to go directly to the Board of Pharmacy. Also, physician assistants are certified for 90-day prescription privileges, again for Schedule 2, 3, 4, and 5, that are not opioids or benzodiazepine. So there's a 30-day limit and a 90-day limit. Also, physician assistants shall not prescribe, dispense, or administer Schedule 4 or 5 controlled substances more than 5 times in a 6-month period for each patient. That can, I've been called by a physician assistant who did not know that it was only 5 times in a 6-month period for an individual patient. So I've added it to the screen so that you can pay attention to that and not have a pharmacist calling you once you've prescribed. Then Schedule 3 controlled substance, that is an opioid or benzodiazepine, that is refillable without written consent of supervising physician. So for Schedule 3, you need to include something. There's usually in your electronic prescribing software, there's a place where you can do a note to the pharmacist. This is where you can say that you have the consent of the supervising physician, and that supervising physician's name, to be able to avoid a call from the pharmacist. And also prescription-only drugs for a period exceeding 1 year. So you cannot prescribe, nor will the pharmacist fill a prescription-only drug for a period exceeding 1 year. So keep that in mind, especially in Arizona here where we have a lot of snowbirds. If you're sending a snowbird back to the North Country with a prescription that you're hoping will last them through the time that they're gone from their winter home, keep in mind that it will only last for a year. The pharmacist is not allowed to fill it after the year. Christine, do you have your microphone open?
I do not. I had just corrected somebody else's that had just joined. So
okay. Thank you. Thank you. Okay, so back on to our next slide. Again, this is on what shall not prescribe or dispense or administer. So Schedule 2, 3, 4, and 5 controlled substance without delegation by supervising physician, board approved, or USDA registration. Also prescription-only medication without delegation, and also prescription medication intended to perform or induce an abortion. And I will agree with you that this is a little bit of a repeat from the last slide, but I wanted to reiterate it very specifically so that you did understand exactly what it meant, because again, I'm basing much of this on calls that I get from folks asking me questions about things. And also limits, physician assistant must maintain an up-to-date and complete log of all Schedule 2 and 3 controlled substances the physician assistant administers or dispenses. And the good news is oftentimes your software that you're using to do the prescriptions can give you that information so you don't have to actually keep a manual log. Some like to keep the manual log, and others, if they have it available through their electronic prescribing software, they can print it out and they'll have it. You also would want to see House Bill 2075, Section 2532 for emergency situations, and MAT, which of course is medically assisted treatment, which is usually for an abuse situation, and dispensing guidelines and mandates. All physician assistants prescribing orders must contain the physician assistant's name, address, and phone number, not the supervising physician. That specific physician assistant's name, address, and phone number. And also, it must be prescribed under the physician assistant's DEA registration number, not the prescribing physician. And the physician assistant must either, to keep your license up, complete 45 hours of pharmacological or clinical management of drug therapy within the preceding 3 years before you go and get your license renewed, or you are certified by a national commission of physician assistants, and there are several of them, and meet other requirements established by the board rule. So if the Board of Pharmacy or your physician assistants national organization comes up with other requirements established by them, then you will need to follow those rules as well. The House Bill 2075 simply says, or other requirements established by the board rule. That could be the Board of Pharmacy or your licensing board. And again, you can look it up on the House bill by following those little numbers and letters on the bottom. This one is in Section 32, 2504. Let's talk a little bit about prescriber and pharmacy responsibilities, because this sheds light, of course, on what a physician assistant is able to do as well. So the prescriber and pharmacist requirements: written Schedule II controlled substance prescriptions. Prescriber may write and the pharmacist may dispense when, and I get a lot of questions about this, the electronic prescribing system is not operational. If your system is down or it's not working correctly, you can write it, but you might want to make sure that you let the pharmacist who you're going to send it to know that it's being written for a reason. A lot of folks will call the pharmacist. Most people know or can ask the patient, which pharmacy will you be taking this to? And you can call, or you can send a note along with the electronic written, prescription, so that the pharmacist will know and your patient isn't inconvenienced once they get to the pharmacy. If the pharmacy management system is not operational, the pharmacist is able to fill the prescription from the manual written prescription. In that case, they must both keep a record of why the system is down and when its system is down, or when it was not operational. I guess that's a better word to use. Again, you can look this up in the House bill under Section 36, 2525, sorry. More information about a prescriber and pharmacist requirements. For written Schedule II controlled substance prescription, the prescriber can write, the pharmacist can dispense. Prescriptions that are sent to a federal or for a patient covered by a federal entity. For example, a VA facility. If you were called in as a consultant at the VA and you wrote a prescription, you could write it manually. It would not have to be written. But I suggest that if you do that, or any of the rest of these I'm about to talk about, that you go back and write it into your patient's chart, and also keep track of it that you've written this federal, a prescription for a federal facility or a military-based facility like Luke Air Force Base, an Indian Health Services hospital, or other Indian Health Service facilities or tribal-owned clinic patients. So if a tribal primary care physician sends you a patient, you are a specialist, for example, and they send you a patient, you would want to make sure that you either, if you understand that you can write it, and you may want to write it, because often the tribal pharmacies, if they're going to fill the prescription in a tribal area, especially if it's a federal facility, they will not have the software necessary to accept an electronic prescribed prescription. So that's a very important point to keep in mind. Prescribers and pharmacist requirements, again, emergency situations. Emergency quantities of Schedule II controlled substances may be orally ordered and dispensed. Prescribers must deliver written or electronically prepared orders to dispensing of the electronically prepared, I'm sorry here, let me start right over here. Prescribers must deliver written or electronically prepared orders to dispensing pharmacists within 7 days. So in other words, if you have an emergency situation, maybe it's a car accident, maybe it's something to do with COVID-19, and you write or orally, you can orally call it in to the pharmacist, then you must keep track of it. You must keep a written note of it and report of it, and you must also deliver a written and or electronically prescribed order within the next 7 days. So that's for orally prescribed. Again, prescriber and pharmacist limits and requirements for Schedule II controlled substances may not be dispensed more than 90 days after the date of the prescription order, and they may not be refilled. And again, why this is really important in the state of Arizona is because we have a great number of snowbirds in our area, and if you, again, are sending them home with a prescription so that they would be covered while they're out of state, keep in mind that they wouldn't be able to fill it after 90 days. So make sure you remind your patient of that as well. They need to get it filled before the 90 days expires from the date of the written prescription. Medical practitioner limits and requirements. Again, I put this in here because I want to make sure that everyone listening is covered to a certain degree, and these kind of things also refer for a certified physician assistant. Beginning January 1, 2020, each prescription order must bear the name, address, and federal registration or the DEA number of the prescriber and contain only one drug per order. The only exception to that is hospital inpatient orders may contain multiple drugs. So again, I think most people in the past have already included the name, address, and federal registration number of that individual prescriber. But I don't know that everyone understood that only one drug could be on the order, only one controlled substance could be on the order. For medical practitioner limits and requirements, again, initial Schedule II controlled substance prescriptions must be limited to a 5-day supply, except a 14-day supply limit following a surgical procedure, oncology diagnosis situations, and traumatic injury pain management. So those are all situations that oftentimes in your clinic you're not going to be seeing that much of. But in this day and age of chronic illnesses and all the kinds of things that are going on with the COVID-19, you may need to keep these kinds of things in mind as you're doing it. So I know a lot of orthopedic surgeons will give a prescription to a patient for pain medication, of course, which is a Schedule II and or an opioid, and they often want to give a 30-day supply or whatever. Remember to keep it a 14-day supply for following surgical procedure and the other two, oncology diagnosis as well as traumatic injury. Again, medical practitioner limits and requirements. The initial Schedule II controlled substance prescription is limited to a 5-day supply, except, here's our exceptions, a hospital patient in end-of-life situations, palliative and or scheduled nursing facility patients, burn or MAT treatment patients, MAT is medically assisted treatment for substance abuse, and also for poor little babies, infants being weaned off opioids, having born to a mother who was on opioids at the time of pregnancy. Again, pharmacist limits and requirements. If authorized verbally by the prescriber, the pharmacist may correct errors or omissions on a written or EPCS order to a date, strength, dosage, quantity, and use directions. So keep that in mind. Oftentimes I'm finding that even though they can go ahead and do that, they do need to get a verbal authorization from the prescriber to go ahead and correct those kinds of things. So you will get a call if you are not doing this correctly, and a good pharmacist will catch those kinds of things which you want them to do so patients are not harmed. Pharmacist limits and requirements, again, if authorized verbally by the prescriber, the pharmacist must document changes made, like by the time, date, prescriber granted authorization to the corrected order, and document an original order. So it's important that if a pharmacist calls you, remember to help them remember that you need to give them that kind of information. They need to put it on their order, and you also may want to keep track of this for your information. So this concludes the part of the presentation today that is about the requirements and mandates Now I want to talk to you a little bit about the Controlled Substance Prescription Monitoring Program, which many of you refer to as the PMP. What is the PMP? It's a state-run database that collects patient-specific prescription information at the time of dispensing from a pharmacy. So in other words, what it means, the purpose of it is to improve clinical decision-making, reduce doctor shopping so that people aren't going out there and getting multiple prescriptions. It's amazing what you can see when you look back at the PMP. I've known of several situations where they're looking back and they recognize the doctor shopping by different prescriptions for opioids being written by multiple different doctors. It also decreases the inappropriate prescribing, reduces diversion of controlled substances, and assists in other efforts to curb the prescription drug abuse epidemic. And I think it's really, really important because Arizona, as most of you know, Arizona has a great problem with the opioid abuse. It's getting better, but it's still up there. And the law I have in blue down here, beginning October 16, 2017, everyone was required, either written and or electronically prescribed, to access the information in the Arizona CSPMP before you write a opioid prescription or a benzodiazepine controlled substance. So that's been this has been in place since 2017, and it amazes me how many calls I get every week about people who did not realize and are asking questions, how do I get set up with a PMP? So controlled substance prescription monitoring, it's actually, here's the information about the law and what's required. So you're required to review the 12 months, preceding months of a patient's PMP record before prescribing an opioid or benzodiazepine controlled substance listed in Schedule 2, 3, or 4. And exceptions, of course, are medical residents may register using the hospital's DEA number. So when you're registering in the PMP, if you haven't already registered, you have to use your own DEA number. You can't use your supervising physicians. You have to use your own DEA number. Except for medical residents may use the DEA number of the hospital. And I've given you a link here where prescribers can register to join the PMP. And for more PMP information, you can click here at the bottom of this slide, and as Christine said, she will be sending out the slides so that you will have them and you can click on the slide once you bring it up on your machine. Also, there are some very, very neat videos and how-tos on the Board of Pharmacy's website that will help you better understand how to get set up and how to use it, how to use the PMP. Ways to connect. So once you're registered on the PMP and you're checking for your patients, you can do it in 3 different ways. You can do it via the Board of Pharmacy's website. So once you're registered, you log in with your license and patient name, and you sign in, and you are able to look at the past 12 months for that patient. You also can accept it in many, many electronic health records, your EHR, are now offering the ability to go directly from within your EHR over to the PMP, get the information that you need, and go back to your EHR. Some of them even show you immediately when you click to do the prescription for that specific patient. Or you can go directly to the, what I need to say here is, you can also go and find an interest form to find out if your EHR is offering that direct access. And many, many of them are, and more of them are being added all the time. You also, if you are a Health Current, Health Information Exchange HIE participant and are using the portal, you can go through the HIE portal and get directly to the PMP and find out about your patient there. So additional information, I've given you a link to the Health Current website so that you can look it up there. But I do encourage you to go to the pharmacy website and look at the different tools that they have to help you understand. Also, next month, the webinar in this series is the CSPMP webinar that covers all aspects of the PMP, and it will be presented by Lynn Curtis, who is the PMP expert at the Board of Pharmacy. Very interesting, very, very interesting. He includes a lot of good information on how to use the PMP. So I encourage you and urge you to check out when the webinar is and sign in for it. Let's talk a little bit now about where we are, where Arizona is in the national landscape. As of June, we continue to be fourth in the nation for prescriber readiness, and that's pretty good. We're actually right now tied with Iowa, for those of you who are from Iowa. New York is number 1, North Carolina is number 2, Iowa is next, and 4th. I'm going to show you something quickly here. This is state rankings at the end of 2019. We were number 4, and we were 11 in 2018. We made the fastest jump of any state getting to where we needed to be. So let me move on to where national averages and where we are for EPCS as of June. I was not able to get July information yet. If you look at the bottom of the screen, SureScripts is, and I've given you a link to it there. SureScripts is the company who provides the information of where everyone stands within the nation for electronic prescribing, as well as regular prescribing. So nationally, pharmacies enabled are 97%. In Arizona, we're 99%. The only ones that are not able to accept electronic prescriptions for controlled substance in Arizona are a few mom and pop organizations, as well as the federal pharmacies. So prescribers enabled, and nationally it's 51%. We're at 74%. So we are 23% ahead of the national numbers. I'm hoping we can bring that up, but I think we're pretty close to where we're going to be, because we have most of the folks who need to prescribe are already prescribing electronically, or they wouldn't be able to prescribe because there are no waivers. You have to EPCS, or you can't prescribe unless you have a system outage. So the only hope that I see for us gaining any more ground is when the federal facilities are required to EPCS, and also we may gain a little bit of ground when veterinarians are required to prescribe. So that's where we stand at number 4, gain from 11, pretty good. So I told you in the beginning that I'd share a little bit of information with you about the CME, free online CME opportunity. Here's where you can go to find it. Go ahead and get, when you get the slides, Christine sends out the slide deck, you'll be able to click on this and go to it and check it out and see if you can use it. Get yourself a free CME. So what other kinds of information do we have from the Click for Control campaign? There are a lot of things on the Health Current website that you'll be really interested to see. We have some fact sheets, some basic things that you can share with your new prescribers that join, especially those that come from out of state. We also have the future and upcoming webinar presentations and other things, newsletters and articles. There are slides. If you want slides to include in any of your in-house or other presentations you're doing, give me a buzz on the phone and I'll be glad to share some with you and even prepare some for you if you need it. And also there's additional support. We provide phone-based assistance. We're still offering that and will for probably well into 2021. And also email communication. If you send me an email, I respond to you, and as most of you that have called me know, when you call me or email me and we talk on the phone, I will send you an email reiterating our phone conversation so you don't always have to try to remember everything I told you in our conversation. As I said, we have one more webinar in this campaign, and that is the CSTMP coming up on Thursday, August 20th at noontime. And I would love for anybody that's on this call to tell me what else I can do to help you over the next coming months. What other kinds of information would you be interested in learning? How could I redo some of these or represent them again? What can I do to help you with electronic prescribing of controlled substances? We're willing to do whatever that would be beneficial to you. So email me or text me, whatever works for you. That would be really, really great. I'd love to know that information. One thing I want to remind you of is that we did this to educate you and help you understand what you need to navigate up all the EPCS. Remember, those of you can remember back when you had to adapt the software and learn how to use it and prescribe and all that kinds of stuff. I would encourage you to review and interpret the legislation and mandates for your specific situation and needs. And that's why I put those little things at the bottom of each one of the slides. Back here to, like at the bottom of the slide where you see on this slide here, Section 36, slide 2525. So be sure that you look up those things. That's important for you. Let me get back to where I was here. And here's my information. Please don't hesitate to call me. Because we are all working from home during the pandemic, I should have given you my, I'll give it to you right now and you can all write it down. If you call if you call 268-87210 number, you're going to get my voicemail because that's my office phone. You can call and leave a message there. I check it every day so that I can get back to you as soon as possible. You also can call our main switchboard, 602-688-7200, and they'll get you in touch with me and give me my cell phone number. But I'm going to take a big chance here and give you all my cell phone number. It's 480-309-4529. That is my personal cell phone number, so please don't call me in the middle of the night. And please be respectful that I am sharing it with you, because I know during this pandemic it's very difficult for folks to get the help that they need. And so I'm offering you that information to help you out. So as Christine said, there's a chat box. She'll tell you about it again. Thank you all for your attention today, and please let me know what we can do for education and outreach to you to help you better understand and adapt EPCS and also regular basic e-prescribing as well. So thanks for your attention today. Christine?
Thank you so very much, Connie. Thanks to everyone that is joining us today. The chat box is open, and I am not opposed to opening up lines, but if there's a lot of feedback, I will have to mute them. So this way, folks, if they'd like to ask Connie directly a question, they're welcome to do that. If not, I can put you back on mute. So again, the chat box is open, as well as any open questions for Connie at this time. Oh, could somebody type it on the keyboard?
I believe they can also raise their hand, can they not?
Yes, they can. You can also raise your hand as well.
I guess that would be called raise the hand feature.
That is correct. I'm not seeing any questions come through the chat box. We'll give everybody another minute in case they are typing away. Just a reminder that today's call was recorded and will be posted up on the Health Current website. And we will also be sending out a copy of the slide deck to all of our participants today. So you'll be able to access any links, any House bills through Connie's presentation. Well, so far we've got no questions coming through the chat box. Again, Connie's contact information is here, either directly at the erx@healthcurrent.org. You can call the office line at 602-688-7210. And Connie has provided her personal cell at 480-309-4529. Oh, we do have a question here. Connie, what if a patient does not know which pharmacy they want to go to? Can they take a written prescription at that point?
No, unfortunately, there's no wiggle room for doing a written prescription. I would suggest perhaps that you, ask the patient where the closest pharmacy to them would be. You really do have to know where to send it for them to understand that. The other thing that I would say to you in this situation, and I know several practices have done this, because folks are used to walking away with a written prescription, if you create a flyer that explains that you're now doing electronic prescribing, it's going to go directly to their pharmacy, they don't have to worry about losing the piece of paper, that the prescription. By the time they get to the pharmacy, it can be filled for them to pick up. They won't have to wait around. And, that's the benefits to them so that they understand. You also can include some things on there, very brief things on there about preventing opioid abuse and fraud, and hand that to the patient. That will help them understand why it's important that they provide you with the name of a pharmacy. I know of one place that has that type of issue, and it was actually a behavioral health situation. So they were dealing with folks that were having difficulty understanding what they were telling them to do. So they did write they were using what I just described, a flyer to hand to the patient, and they wrote on there where the prescription was actually sent to so that they could get it. Hopefully that answers your question.
Wonderful, thanks, Connie. Any other questions? Either you're welcome to unmute your line if you would like to ask Connie a question directly, or again, the chat box is available and open.
I'll add one more thing, Christine. If you go beyond the end of this slide presentation, on slide 40 and 41, I've given you, if I can get back to that, I've given you the link for you to get to the original House bill that made it legal in Arizona to EPCS. Also a national bill that's before the nationals that's kind of put in a little bit of a whole pattern now with the opioid, with the COVID-19. And also I've given you the link to the opioid epidemic bill text, also a policy primer, which is a video presentation, and then also the link to House Bill 2075. So that will help you better understand what's going on there. And also the regulations and mandates where you can find more information about them. And I think we have something else in the chat box, Christine.
We do. Do you know the definition of initial prescription? What if they had a prescription for 366 days ago?
If they had a prescription for 366 days ago, it's my understanding, although I would want you to verify with the Board of Pharmacy, that if it went for 366 days, it would not be acceptable because the law states 365. but I really suggest that you talk to the Board of Pharmacy. They are the experts in that area.
I think
Sorry.
referring as it relates to meeting in regards to the 5-day rule. So a prescriber.
Say that again, Chris.
Go ahead.
Say it again. What did you say?
The question is meeting in regards to the 5-day rule. So if they had perhaps an initial prescription, and then what if they had a prescription 366 days ago, but in regards to the 5-day rule? I'm not sure I'm clear on your question. I apologize for that.
Yeah, I don't understand either.
Welcome to take yourself off of mute if you like. If you would like to speak directly to Connie, we're happy to try to better answer your question.
Or you can call me later and then I can provide the information that I provide to you to everyone else on the call as well.
Okay. Well, I'm not sure that we're going to see any additional questions come through the chat at this time, but just a reminder that Connie is available directly on her cell phone following today's call, or you can email her at erx@healthcurrent.org, and we'll be happy to get any other additional information that you need. With that, Connie, I don't see any additional questions in the chat box, so I think oh, no, here's another one. What amount of time must pass between 2 prescriptions in order for the second prescription to be considered an initial RX again, and its limit to 5 days? So I'm reading this as if a patient has a prescription and they go through the 5-day limit and they have a second prescription, how does that work? What is the 5-day rule? Would they get a refill after the 5 days is up because they have another script? How much time has to pass between prescription orders for opioid?
Well, first of all, you can't renew a controlled substance. It has to be a new prescription. I would suggest that you, again, because I don't set those rules, I would suggest that you call the Board of Pharmacy and ask that question. If you'd like to email it to me, I will be happy to ask the Board of Pharmacy for you and get back to you. Either way.
Yeah. So if someone has an initial prescription, Connie, and they have it filled at the pharmacy, and then they come back on day 6 with a new prescription, will the pharmacy refill that again?
They may refill it again, or they may call the prescriber and ask the question if it can be, is this a mistake or is it actually what needs to happen? Again, Christine, we aren't qualified to answer that question. That is something that the Board of Pharmacy would need to answer.
Okay. All right, we'll have to circle back around on that question for this participant. Any other questions today? All right, with that said, we'll go ahead and conclude today's webinar. Thank you again for participating. Just a reminder, we will send out the slide deck, and the recorded webinar will be posted up on the Health Current website. Thank you again for your participation. Thank you, Connie, for presenting, and I hope everyone has a wonderful day. Take care.